though it is a very vast field to discuss, today I am emphasizing on only cancer screening test. Generally, we do the cancer screening test by two simple methods. One is cytology and another is histopathology. Suppose a patient has developed any visible lump or swelling or mass in any part of the body. We can screen that lump whether that is a neoplastic, and if it is a neoplastic one, whether it is a cancer or non-cancer tumor. We can do that by a very simple test that is called fine needle aspiration cytology. In that case, we aspirate some part of the cells from that lump by the help of a very fine needle. We give some negative suction to aspirate those cells, and then we take those cells on the slides and we stain them accordingly by Pap stain or Romanowski stain, and then we assess the cell morphology, the nature of the cells under the microscope. From that, we can decide whether it is a malignant tumor or a non-malignant benign tumor, or whether it is a tumor at all or not. Now, if it is a non-tumorous lesion, that means it may be an infective one or something else. In that case, the doctor can give a conservative management to cure that. Suppose it is an abscess. But if it is a tumor and it is given as a benign tumor, then only excision of that tumor is enough to cure that, and then we do histopathological investigation of that tumor. But if we give the diagnosis as a malignant tumor, then the treating doctor or surgeon has to do an extensive surgery to cure the patient from that malignant tumor. By this screening test, a very simple fine needle aspiration cytology, we can decide the nature of the tumor. There is another mode of this cytology which is called exfoliative cytology. What is that? In some body cavities, every day some cells are shedding off, like in oral mucosa or in vaginal or posterior vaginal wall, etc. We can collect some cells from that and we study those cells to see whether there is any malignancy or any atypia developing in those cells or not. By this method, we can screen some malignancy from the cervical region of the female genital tract and or from some oral mucosal lesions. So that is another mode of screening which is called exfoliative cytology. Now there is a very advanced technology which we call a true cut biopsy. What is that? We generally with the help of a wide bore needle, we take some strips of tissue from some tumors or any lump and we study them under microscope to see again whether the tumor is a benign tumor or a malignant tumor. So these are very simple OPD based tests which can be done, and patient can be released on the very day without any large scar or any injury to the patient, and we can give a diagnosis to screen the nature of the lesion. So these are some invasive investigation but very simple one. There are some modalities to screen some tumors which are called, there are some biochemical markers also. By the help of those markers, we can assume whether there is any neoplasm or tumor is developing in any of the part of the body or not. What are those? Three very commonly used biochemical markers are CA125, CEA, carcinoembryonic antigen, and CA19-9. These tests are done from the blood sample of the patient. If we get a raised value of these markers, suppose the patient has developed a high level of CA 125 marker, then we can assume that there is any neoplasm in the ovary of that patient. If the patient has developed any raised CEA level, in that case we can assume some neoplastic diseases is developing in the gut of the patient, like that. So these are some simple techniques by that we can screen. Not only screen, we can diagnose the case before considering any major surgery. So these are the simple screening tests to detect any malignancy.